Hi, my name is Morgan Fetterspiel, and I'm going to be checking off on my focus assessment today. And I would begin on reading my patient's chart, and I would see that my patient is Brittany, and she has a laceration to her lower left arm. So that's what we're going to be focusing on today, in addition to a quick head to toe. I would gather all my equipment. I have my stethoscope and my pen light, just for the head to toe assessment. And then I would wash my hands and put on my gloves, since we're going to be potentially dealing with a wound. And then we would go into the room. Brittany? Hi. My name is Morgan, and I'm going to be your nurse today. Can you please verify your name and date of birth for me?
Brittany Esther, 11898.
Awesome, nice. I'm going to provide some privacy by closing the door. And then today we're just going to be doing a quick head-to-toe assessment with a really big focus on that arm of yours. You said it was your left arm that was hurt?
Yep.
All right, could you just pull that sleeve up for me real quick? Thank you so much. All right, and then I'm going to raise your bed to a safe working height so that I don't have to bend over. Ergonomics are great. So, what happened to your arm? What'd you do today?
I just fell and kind of scraped it up.
Okay, you just fell and kind of scraped up your arm?
Yeah.
All right, so you remember what happened, that's good. All right, but we're gonna start with that quick head to toe, okay?
Okay.
So if you could just look straight ahead for me. I'm gonna assess her pupils for Proa. Good, pupils are equal and reactive to light, and if you could just open your mouth and say, for me. All right. Her mucous membranes look good, and I don't see any unusual discoloration or swelling or edema anywhere else. I'm also going to look in your nose real quick while I'm down here. Her nostrils appear patent, and I don't see any abnormal like swelling, discharge, or any other abnormalities really. Okay, and then I would check your oxygenation status. I don't see any cyanosis anywhere. If I could see your hand please for a quick second, I'm going to do some cap refill. Good, her cap refill is nice and brisk in both hands, and if her feet were exposed I would also check there as well. Okay, next we're going to move to your lungs. So when I say take a deep breath, I'm going to have you do one big inhale and one big exhale for me, okay?
Okay.
All right, we're going to do that 4 times. All right, deep breath. Deep breath. Deep breath. Deep breath. Good. I don't hear any adventitious lung sounds. They're equal and clear bilaterally, so that's good. Next, I'm going to listen to your heart at Erb's point so that I can hear both S1 and S2 nice and clearly. All right. Heart appears to be good. It's nice and even. I don't hear any murmurs or any other issues going on in there. All right, so we're going to go ahead and lay your bed back down real quick because I'm going to do a quick abdominal assessment. Awesome. And while we do this, I'm going to go ahead and feel for your distal pulses as well. All pulses are present, equal bilaterally at approximately a +2. Okay, so can you tell me when your last bowel movement was?
This morning.
Okay, good. So she's nice and regular, assuming so, and seeing as it's still morning, we're not concerned about that. So I'm going to go ahead and listen to your abdomen starting at the lower right quadrant, just to make sure we have some good sounds, okay? Good. So she had good bowel sounds, nice and present in all 4 quadrants, and when I assessed her skin, I didn't see any abnormal distension, lesions, ulcers, discoloration, anything crazy. So we're going to go ahead and move on to your skin turgor, which also matters. So I'm going to check your hands again. Good. She's nice and hydrated. Her turgor was good. Her skin snapped right back into place. I don't see any catheterization or IV lines present. However, if there were any present, I would make sure to check sites for any infiltration or infection, and make sure none of that was present. I would check skin color and temperature, drainage, anything like that for signs of infection. So, while she's laying down, I'm going to continue to check for edema in her more distal limbs. So I don't see any in her calves or ankles, her arms. I don't see any crazy edema there, including injured arms. So that's good. And then we're going to go ahead and sit you back up over time. So what were you doing when you fell? Do you remember?
I was running.
Okay, so she was out for her morning run. Nice and healthy, good health habits. All right, cool. And then if I could just have you lean forward for me so I can assess your posterior side. I'm gonna check her skin back here and check for any skin breakdown. I don't see any. I don't see any discoloration or swelling or edema anywhere here. I'm also gonna check your posterior lung sounds, if that's all right with you.
Yeah.
So remember our deep breath instructions. I'm gonna have you take a deep breath every time I say so, okay? All right. Deep breath. Deep breath. Good. Deep breath. Good. Deep breath. Good job. All right. So everything outside your arm is looking good. So I'm gonna now assess her arm with a more focused assessment. So to me, the wound edges look decently approximated. It's a small laceration, so it's nothing too bad, but it might require some physician intervention. I don't see any swelling or edema. Her skin temperature at the site is a little bit warmer than her skin temperature distally and proximally, which is to be expected at the site of a fresh wound, so that's okay. I don't see any purulent drainage. I do see some serous drainage, or not serous drainage, sanguineous drainage. So that is perfectly normal for a fresh wound as well. So yeah, I think we're good. Physician will be in to see you in 15 to 20 minutes. If you need anything, your call light's right here if you need to ask me. Do you need anything right now?
I'm okay.
Okay, how are you feeling?
Pretty good.
Good?
Yeah, just
All
a
right.
little bit of pain.
All right, a little bit of pain? Good. Yeah, can you move your arm for me just to make sure that we can? All right, good. So that's a good, decent range of motion, active range of motion. Can you move your other arm just to make sure it's the same? Good. Nice. And can I have you roll your ankles too, just while we're thinking about it? All right, good job. All right, nice. Okay, so range of motion was all good. So you're in a little bit of pain?
Yes.
Okay, I'll consult the physician to see if I can get her some pain medication for that. And if you need anything else, anything to eat or drink, if your physician says it's okay, of course, then go ahead and press your call light right there for me. And I'm gonna put my bed back down so that if you need to get up, you can. Things are nice and slow. All right. Thank you so much for letting me be a part of your care today. I'm so sorry this happened to you, and I hope we'll get you taken care of quickly, all right?
Thank you.
Thank you. Okay, then I would take off my gloves. Exit my room. Boop. All right, and then I would clean any of my equipment. So I would clean my stethoscope since it did touch my patient. Maybe my pen light too, since my hands were touched also. I would I already disposed of my gloves, so that's all taken care of. Yep, I would wash my hands now that I have done that, and I would document everything that I just did so that the physician knew what was going on.